Hello and welcome to Small Business 21st Century and today's segment of Build Your Difference. I'm your host, Pierre Walters, and today's guest is a medical detective. She helps people figure out what is wrong. She goes through the entire process of elimination to get to the actual root cause of whatever the medical issue might be, free from medication and surgery. She brings with her a wealth of experience from everything from musculoskeletal physical medicine and rehabilitation, occupational medicine, medical leadership, and functional medicine. She earned a degree in medicine from Meharry Medical College in Nashville, Tennessee, a residency in internal medicine, New England Deaconess Hospital of Boston, which is now known as Beth Israel Deaconess, a Harvard Medical School program and hospital in 1992, and a second residency in physical medicine and rehabilitation at Loyola University Medical Center in Maywood, Illinois. She is board certified by the American Board of Physical Medicine and Rehabilitation, anti-aging, regenerative, and functional medicine, and integrative and holistic medicine. She is also subspecialty boarded in sports medicine. She also served as a clinical instructor on the faculty of both Northwestern University and the University of Illinois. So we are honored to welcome Dr. Serena Satcher, the founder and CEO of Treat Yourself to Health. Dr. Satcher, welcome to the show.
Thank you. Thank you. Such a generous introduction. Thank you. I'm honored.
It is our pleasure. We are so excited to have someone with your expertise, with your background on Build Your Difference to help all of us understand, what are some home remedies, some home approaches that we can take to improving our health. But first, before we dig into that, I want to just kind of get a little bit more about your background and really just help us to understand the area of specialty that you really focus in on. So for the newcomers out there, what kind of doctor are you?
Yeah, so I trained in conventional medicine first, and I worked in rehabilitation medicine for years in a hospital and also in the outpatient setting. And then I learned about these areas of holistic medicine. I went to the Canyon Ranch for a special program where I was with a group of Black women from Los Angeles who had a holistic medical group. And they made a special program for us. It was 5 days long. And they exposed us to holistic, integrative, and functional medicine, especially tailored for Black patients in that instance. And then I was hooked after that. And I went to training for many years and got many certifications, as you listed there. And now I serve people by helping them to find wellness and to get off of medications, avoid surgery, and just be their best selves.
That is incredibly inspiring because the community that we are a part of, historically, there's a huge disparity there in terms of access to quality health care and access to even education to be able to know what we can do to improve our health. And what I'd like to know is, it's clear to me that you're very passionate about this, but could you kind of describe for us the landscape of this disparity? Well, for those of us who are not part of the Black community, can you help us to understand what is the disparity that we are facing in the Black community when it comes to access to quality health care or even medicine?
Well, first off, I'll say that many people can relate to the health disparities because it's not just Black people that have the health disparities, but it's also Native Americans, it's also the Latino community that has health disparities. In fact, Jewish people actually have health disparities depending on what part of the country. And people of the Appalachian region of the United States have health disparities. And what it means is that they may not have access, or they may not be treated equal to everyone else as far as either access or even being offered treatment. And so the area that I work in the holistic realm, is actually not that different from the rest of healthcare, because in the United States, the majority of people providing any type of healthcare or wellness are Caucasian. So the rest of the groups are generally in the minority and generally are parts of the disparaged groups, which is interesting. The control of medicine in the United States, because of the Flexner Report in 1940s, which was written by the Rockefellers and other families that were controlling the financial sector of the United States, decided that they were going to X out all the traditional medical wellness, holistic, traditional, like the Native Americans and the slaves brought herbal medicine,
Okay.
other types of energy medicine here to the United States. Well, they decided with this report that they were going to control all of medicine in the United States and get rid of everything that was not either medication or surgery. So with that report, it switched the whole thing in the United States onto medication and surgery. The medical schools were formed from that. So all the holistic knowledge, all the traditional ancient ancestor knowledge that we had and that we brought here from the African continent, others brought it from Asia. Many of the Native American or indigenous people that were here on this continent had herbal healing and knew energy healing and knew how to use the moon, the star, the sun, the earth, the energies to heal. They got rid of all that. So now we're bringing it back. It never really went away because ancestors verbally passed it down through generations, but it's coming into more prominence and people are paying attention to it because it works. And people also that are immigrants to this country, from whatever countries they come from, they know that their great grandparents used this type of medicine and that it works. And we didn't have modern medicine until, the late 1800s, 1900s. So how did we survive for tens of thousands of years without medications? So illness is not a deficiency of medication or surgery. Illness is a deficiency of nutrients, a deficiency of spirituality, a deficiency of soul, a deficiency of like the natural elements, right?
And Dr. Satcher, you've seen in your practice and over the course of your career, you've seen definitive proof, case studies that show that this approach, the holistic medicine, does provide a tangible benefit into helping people become well. That we often is not publicized or perhaps is even ignored. So you've seen this proof firsthand. Am I correct? Is that correct?
I have, and I came from academic medicine, where the hurdle is always randomized controlled trials and having evidence base. And that's kind of a code word in medicine right now, evidence base. And I think that's what you're speaking of. Like there is research that backs up this type of medicine. And I would say that this research is not in its infancy, but it's been underfunded. And it, of course, has not accumulated to the extent that the research in conventional medicine has, because it's like a catch-up game is being played. So there is evidence for a lot of what we do, but evidence is still being accumulated as we speak.
So this is just fascinating to me because I'm someone who I have benefited from surgeries and such, and, that kind of stuff in medicine at hospitals. But I also am really hesitant to embrace a lot of the medicines that sometimes are recommended and such. And I don't know. I I have feelings about that, and I'm often concerned, and I often try to find, well, what are some natural ways that I can introduce wellness into my own life? And so, what I'm curious is, how are you different? Because I understand you have your own practice, Treat Yourself to Health, and I'd like to know in what ways is your practice different from other practices that might be in a similar in a similar field or offering a similar approach? What is it that people should really consider that makes your practice different?
I think what makes my practice different is that I've had experiences myself with health, both negative and positive, in the healthcare system here in the United States. And like you said, surgery and medications have their role. And what I think of at first is like if you were in a car accident, you would want to be taken to the emergency room where you would get the top-notch emergency care in the United States. However, if you have a chronic disease like high blood pressure or diabetes, you would want to understand how your lifestyle is contributing to the illness that you have.
Okay.
So I had myself a fibroid that was pretty large. It was the size of a softball.
Mm.
And by the time we figured out it was there, I actually had been running in a triathlon and I had to stop in the triathlon to use the restroom. And I had done a marathon and two other triathlons before that. So having to stop and use the restroom was just a big red flag, because if you train in like endurance training, you know how much fuel you need, you know how much hydration you need. So you shouldn't be stopping in the middle of a race to go potty. So when I found out that it was already the size of a softball, I agreed to have surgery, because if I did not have surgery at that time, I would have gotten more like nerve damage to nerves in the pelvis. So I went ahead and had the surgery, but then I found out when I had the surgery that there were multiple other fibroids in there, but they were small.
Okay, wow.
So
Let
I
me
had
let
to,
me let me just jump in right there because we have got to go to commercial break and your story is getting really good. So I want to know what happened, when they discovered that there were multiple other fibroids, and what was the next step? I want to know. So listen, if you're watching it and you're enjoying this, it's time for us to take a short break. So we're going to return after these important messages. Stay with us.
I'm Essie Pathamergerson, an actor, but I'm also one of nearly 26 million Americans with diabetes. To help reduce the risk of serious health problems, my doctor and I tracked my A1C, which is my average blood sugar, over 2 to 3 months, and we created my personal treatment plan that includes lifestyle changes and medication to help me reach my goals. When you have diabetes, achieving your A1C goal is key. So talk to your doctor and visit bloodsugarbasics.com today.
And welcome back. You are watching Small Business 21st Century and today's segment of Build Your Difference with my special guest, Dr. Serena Satcher, the founder and CEO of Treat Yourself to Health. Now, prior to the break, Dr. Satcher was sharing her own personal challenge with having discovered a fibroid in her body that was about the size of a softball. And I hope I'm saying that right. Now, Dr. Satcher, you said that once you were able to get it checked out, that they discovered even more smaller fibroids in your body. Could you pick up from there and let us know what happened?
that's correct. So then I knew I had a job on my hands, because the surgery wasn't going to solve the problem. That I had to learn how to solve the problem myself, because these other fibroids were going to come back if I didn't. And I had women on my mom's side of the family who had all had hysterectomies. Because of my background in sports medicine, physical medicine, I knew I did not want to have a hysterectomy, because there are ligaments connected to the uterus that are connected to your back muscles that control the whole spine. So I went on a hunt and I went to courses, and I mentioned going to the Canyon Ranch that was following that. And I was just off and running after that and just read tons of books and learned how to alter my diet and my nutrition. I continued to exercise. I reduced my body fat. And I think the most important thing was changing my nutrition because I had a pretty healthy lifestyle. Other than that, I had another scan a year later, and all of those fibroids were mostly gone or shrunk down to so small they could hardly see them.
Wow,
So
wow, wow.
and also, I'll mention too
Mhm.
that in recovery from surgery, I also learned that there are things that you can do to improve and speed up your recovery from surgery. So there are a lot of things that can be done in combination with conventional medicine.
Dr. Satcher, did you have someone in your life that was providing for you the kind of guidance along this journey that you now provide to your own patients who are on similar journeys, or were you sort of left to kind of figure this out on your own? How did you deal with this? Did you have guidance?
So I found out in more recent years. I think what kind of got me on this journey was one of my grandmothers actually was known in her community for her knowledge of herbs, of roots, and making teas, and using plant medicine to help people heal. They lived in a rural community on a farm. They were Black in Alabama, so they didn't have access to, health care. They couldn't go and see a white doctor. There was only one Black doctor for within a 50-mile radius that would come to their home. So they had to make do. They had to do with what they had. So that's behind my motivation. I also went to Africa as a child and saw like what was happening in the villages, that most people there didn't have access to modern healthcare, but that they were able to take care of themselves with the knowledge that they had. So that's my motivation. Um, and, I would say that that's what keeps me going too. I was motivated to go to medical school because my parents, I told them that I wanted to be a nurse. And this was like back in the 70s. So I didn't really know that, I had a chance to be a doctor. So my uncle, my dad's brother, is also a doctor. And of course, he was ahead of me. So I saw that example in my family, and my parents told me I could do it. So I knew I could do it.
Hmm. That's incredibly inspiring. That's, so, with someone with your expertise and with your life experience and with the motivation that you take from looking at your own family history, what is it that keeps you up at night? What is it that you're concerned about, right now in this time in history?
So, of course, I call what I do root cause medicine. And I'm very concerned about our souls and our spiritual development and how stress is affecting us. And I know that the mental, emotional, spiritual is really the center and affects all of our health. It affects all of our body systems. There's a woman named Candace Pert that actually lived in Bethesda, Maryland, and I got to hear her speak when I was living in the DC region. And she discovered these molecules of emotion, which are little packets of neurotransmitters and cytokines that communicate between the brain and the gut via the vagus nerve. And the vagus nerve is the largest nerve in the body. But, anyways, that vagus nerve and the communication that is going on controls the rest of our health. So what keeps me up at night is knowing that we have so much mental illness. We have so much mental illness that's undiagnosed, and that the cure for a lot of this is not medication, I'm not saying that people should go off medication that have mental illness, but they should work towards incorporating simple things like optimizing their nutrition, eating better, hydrating, exercising, getting sun, detoxifying, and relieving stress. I think those are the main things, and that a lot of these things are easy, and we have access to doing that at home.
Dr. Satcher, you know, what you're describing to me and I'm not a medical professional, but what you're describing to me sounds like a balanced lifestyle. Would you say that that maybe too often when we are prescribed a certain medicine, maybe if we are faced with a mental illness and we're on a certain medicine, that sometimes it can be easy for people to just only rely on that medicine and not ensure that they're also living a balanced lifestyle? Because that's kind of what it sounds like to me that you're describing. Is that, am I on the right track?
You're exactly on the right track, and it seems to be that this knowledge seems to be generational. And what I mean by that is that, for instance, my parents' generation, my generation, probably a little bit below my generation, down to like age 40, people, when they get prescribed a medication, they just like accept it as bond and they don't try to do anything about it, just on the whole. But the millennials have a different mindset and a different attitude. They seem to automatically like gravitate towards improving their nutrition, improving their lifestyle, learning things like yoga, Tai Chi, you know, trying to balance the stress. And they have so much stress in their generation. So, you know, I think the rest of us could learn from observing what they're doing.
What do you think people would be surprised to learn or to find out about how this particular holistic and balanced approach could help them? What do you think people would be surprised about if they just learn a little bit more about this?
I think they would be surprised to learn that a lot of their health issues could be resolved naturally without medication. I've taken care of folks that had mental illness that even I thought, I don't even, you know, I won't tell the patient, well, you can get off your medication. I'll tell them, let's optimize what you have going on, and then I'll refer you to a psychiatrist that has an open mind and has a different way of practicing. And I mean, I've been surprised to get a couple of people off of medications for diagnosis of bipolar disorder.
Wow.
Many people have been helped with things like fibroids, hormonal imbalances. Many people that I've helped that have autoimmune diseases like thyroid. And thyroid issues are another one that conventional medicine will tell them that they'll never be able to get off of medication, which is not true. So I think the most surprising thing is seeing some of these people able to reverse their disease. Oh, another example I can think of is someone who was on 300 units of insulin that I got off insulin.
Oh my goodness.
So, yeah. So it's possible.
Wow.
And it's not any kind of miraculous type of thing. It's, you know, the person decides in their mind that they want to make a change. That's the most important thing.
So my next question, I think, is pretty logical. You know, someone who does make that decision and says, you know what, I'm ready to change. I'm ready to introduce a better approach into my life so that I can start really living. How does someone who makes that decision, how do they access providers like you?
So you mentioned the name of my practice, and they can find my website online. And the name of my practice is Treat Yourself to Health, and it's all spelled out. So they can find it on any of the social media pretty much, and they can find my website online. And then finding other practitioners like me, It depends on what they're looking for, but I'm personally listed, if they look up the Institute of Functional Medicine, if they look up um, the Academy of Integrative and Holistic Medicine, if they look up different organizations like that have something to do with integrative or functional or lifestyle medicine, they can find a doctor like me.
And of course, is it fair to say that for people who do reach out through the methods that you've suggested, that that you would sit down with them and provide a free discussion or a free consultation to kind of help them understand what's going on, or help them
Yes.
understand the road ahead? Okay. Okay,
Yes, yeah.
so we are getting real short on time here, so I'm gonna go ahead and ask you for like just one tip. What is one tip that you want to leave the audience with today?
The one tip I would leave the audience is a tip that I just recently gave a family member of mine who has a new medical diagnosis. And I told her to, because she was afraid, and she was afraid of the workup. And I said, well, perhaps you can start learning how to meditate and then ask your body what it is you need to do.
Wow. Okay. So learning how to meditate and learning how to sort of be introspective and asking your own body, what is the next step? Okay. So if you have any questions about today's segment, please look at the information scrolling on your screen. You've been watching Small Business 21st Century and today's segment of Build Your Difference. I want to thank you, Dr. Satcher, for joining us today, and I want to thank you for watching. Have a wonderful week.